Welcome. So we'll be going through another case study. So this is the blood slide that is collected, and these are the results shown. So describe what you see, what is the diagnosis, then what for other investigations can you order, then how we do manage the severe form of this condition, and list 4 complications of this condition. So if you can pause and zoom in on the description of what you see, you can see let's say in this slide here, you can see that there is sometimes it's making like a ring form. Even in this part, that's making like a ring form. So when you describe what you see, you can say ring form. Then what is a diagnosis? So ring forms are a common finding on the blood smear in severe malaria. So in malaria or severe malaria, because falciparum most like cause severe malaria. But if you say malaria here, I don't think there will be any problem. Or if you say severe malaria, there will be any problem. Okay. Then 4 investigations you can do malaria RDT plus MPS, your full blood count / DC, coagulation studies, prothrombin time, activated pulse prothrombin time, RBS, FBS or FBS, U&Ds, creatinine, LFTs, all things. You are all well and good. Then how we do manage the severe form of this condition? So artesunate. So how do you give artesunate IV? So if the body weight is more than 20 kg, you give 2.4 milligrams per kg. And then after you are done with artesunate, you are supposed to give oral artemether-lumefantrine twice daily. So the artesunate you give it the 20 kg if the body is more than 20 kg, the 2.4 milligrams per kg of artesunate, you give it at 0, meaning at an admission, after 12 hours, then after 24 hours. Okay. So this oral artemether-lumefantrine was supposed to be EA. So after improvements, give oral artemether-lumefantrine BD for 3 days. So that was how the sentence was supposed to be. So sorry for this typo. So let me read the question again. So artesunate. So you give artesunate if the body weight is more than 20 kg. You give 2.4 milligrams per kg at 0, 12, and 24. Then after improvement, you do your BS, MPS, you check again, you see how the parasites are, and then if the patient has improved, you can now, after improvement, you can give oral artemether-lumefantrine BD, meaning twice daily, for 3 days. Then you are done with the management. Then if the body, you might ask if the body weight for artesunate, if the body weight is less than 20 kg, then you give 3.0 milligrams or 3 milligrams per kg, same as 0, 12, 24. Then after again the patient improves, you can do MPS, you check again, or you can even continue doing your artesunate IV once daily if the MPS is not improving. Then after it improves, then you can give oral artemether-lumefantrine, which is your Coartem, 3 times twice daily for 3 days twice daily. Okay, so cerebral malaria. List 4 complications of this condition. So complications of this condition, meaning the severe form of this condition. That's why I said here, when you say severe malaria, there is no problem here. So these 4 complications of this condition, you can have cerebral malaria, which is more than 2 generalized tonic-clonic convulsions and or impaired level of consciousness, unarousable coma attributed to malaria. You can have acute non-cardiogenic pulmonary embolism, You can have acute respiratory distress, you can have cardiovascular collapse or shock, you can have malaria, you can have severe anemia. So these are complications of all complications of malaria. And you can also have hyperparastemia, okay, where we have more than 100,000 parasites. So those are some of the complications. Then the other complications which are not here, we have AKI. So we have AKI, and have AKI. So that are some of the other conditions. You're gonna have these are some of the conditions that you, some of the complications of this condition. And the other one, which is most likely they even like to ask about, is the black water fever. So that's one of the complications of this condition, meaning the complications of severe malaria. Okay, so we are now done. Thank you for watching. Make sure you subscribe and hit the bell notification.